Hi everyone, welcome back to my YouTube channel, and today we are going to talk about anti-diuretic hormone. So let's start our topic with introduction. Anti-diuretic hormone or ADH is also known as vasopressin. Is a peptide hormone that plays a crucial role in regulating water balance in the body. It acts on the kidney to reduce water loss, to maintain blood pressure and ensure proper fluid balance. ADH is essential for homeostasis and survival, especially during dehydration or blood loss. Discovery and nomenclature of antidiuretic hormone. ADH was discovered in early 20th century when researchers identified a hormone from the posterior pituitary that prevented excessive urine production. The name vasopressin refers to its ability to constrict blood vessels like vaso and increase blood pressure that stands for pressin. Chemical nature of vasopressin or antidiuretic hormone. It is peptide hormone. It is composed of 9 amino acids, so it is called as non-peptide, and it is water soluble and it circulates freely in the bloodstream. Site of secretion of ADH. ADH is synthesized in the hypothalamus, in the supraoptic and paraventricular nuclei of hypothalamus, and then it is stored and secreted by posterior pituitary gland. Regulation of secretion of ADH. ADH release is tightly controlled by osmoreceptors that are located in hypothalamus that detect changes in blood osmolarity. It is high osmolarity stimulates ADH release, that is concentrated blood, and low osmolarity, that is diluted blood, inhibits ADH release. It is also controlled by baroreceptors that are present in blood vessels that detect low blood pressure and trigger ADH secretion. It is also controlled by stress and hormones as pain, stress, and certain hormones like angiotensin II increase ADH levels. Mechanism of action of ADH. ADH binds to V2 receptors in the kidney, thus activating CAMP pathway that increases the number of aquaporin 2 channels in the collecting ducts. This allows water to be absorbed into the bloodstream, reducing urine output and concentrating the urine. At high concentration, ADH binds to V1 receptors on blood vessels, causing vasoconstriction and increasing blood pressure. Physiological function of ADH. First is water balance, as this hormone reduces water excretion by kidneys to maintain hydration. Second function is blood pressure regulation, as this constricts blood vessels, thus raising blood pressure during dehydration or shock. Third function is blood osmolarity regulation, as this ADH keeps the osmolarity of body fluids within a narrow range, that is about 282 to 95 osmolarity per kg. Fourth physiological function is its role in stress response, as ADH works with cortisol and adrenaline to help the body cope with stress. Clinical significance of ADH. First is ADH deficiency. It causes diabetes insipidus, that is characterized by excessive urination or polyuria, extreme thirst or polydyspia, and dehydration. Its types include that control that is central diabetes insipidus, that is the lack of ADH production. Second type of ADH deficiency is nephrogenic diabetes insipidus, in which kidney fails to respond to ADH. Second clinical significance of ADH is ADH excess, that causes syndrome of inappropriate ADH secretion. It leads to water retention, low sodium level, confusion, and swelling. Diagnostic importance. Blood and urine tests like osmolarity and sodium level help detect ADH imbalances. Water deprivation test is used to diagnose diabetes insipidus. Therapeutic application. First is synthetic ADH, that is also called as desmopressin, that is used to treat diabetes insipidus, bedwetting, and certain bleeding disorders. Second is ADH antagonists, that are also called as leptins, that are used to treat a syndrome of inappropriate ADH secretion and hyponatremia. Factors that affect ADH secretion include that first we will talk about factors that stimulate ADH secretion, that include dehydration, low blood pressure, pain, stress, and nicotine. And then there are factors that inhibit secretion of ADH, that include excessive water intake, alcohol consumption, and low blood osmolarity. Conclusion of this lecture video. ADH is a vital hormone for maintaining water balance, blood pressure, and fluid homeostasis. Even small changes in secretion can lead to life-threatening disorders like diabetes insipidus or syndrome of inappropriate ADH secretion. Understanding antidiuretic hormone role is crucial for managing hydration-related and endocrine conditions effectively. And this is all about ADH. Hopefully you like the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.